Hi guys, this is Dr. Ross, and this is the first presentation of two covering vascular anatomy, and this is for Anatomy and Physiology 2 at Lee College. So I want to review parts of the aorta that were discussed in the previous cardiac anatomy presentation before I move on. So recall that after the blood is oxygenated in the lungs and returned to the heart, it's going to leave once more through the aorta. Okay, the aorta can be further subdivided into the ascending aorta, the aortic arch, and the descending aorta, which you can see at the bottom of this slide. So all three of these things are already labeled. From the aortic arch, the blood can move into the brachiocephalic trunk. This is the first branch of the aortic arch. It supplies blood to the right arm, the head, and the neck. The blood may also move into the left common carotid artery. This is the second branch from the aortic arch, and it delivers blood to the left side of the head. And finally, blood may move into the left subclavian artery. This is the third branch from the aortic arch and supplies most of the blood to the left arm. There's also a right subclavian artery and a right common carotid that I'm going to discuss on the next slide. So in this image, you can see a continuation of the branches from the aortic arch. You can see the left subclavian and the left common carotid arteries here. As I mentioned, there are also right subclavian and right common carotid arteries. These, instead of arising from the aorta, these are going to arise from the brachiocephalic trunk. All right, so the right subclavian artery supplies blood for the most part to the right arm through a series of arteries I'm going to discuss later in this presentation. The right common carotid artery will supply blood to the right side of the head through a series of arteries as well. The right common carotid arteries, as well as the left, are going to branch into the left and right external and internal and external carotid arteries. These are paired, meaning that there's one for each side of the body. All right, so this image is clearly showing the right side of a patient or another person's head. Keep in mind that the arteries present on this side are also going to be present on the left side. So the subclavian artery, as I mentioned, is going to supply mostly blood to the arm, but it also supplies blood to the neck via the thyrocervical trunk, which is branching off of that subclavian right here. And then also another branch from this is the vertebral artery. The vertebral artery originates from the subclavian artery, and each vertebral, one from each side, is going to course up along each side of the neck, and then it's going to merge within the skull, and that's going to form a single artery. So ultimately, this artery will supply blood to the upper spinal cord, the brainstem, the cerebellum, and the posterior part of the brain. The carotid sinus is a neurovascular structure, and it's located right at the beginning of the internal carotid artery. It is also localized near the arterial pulse point. The carotid sinus contains baroreceptors. Recall these are stretch receptors, so they inform on stretching of the vascular wall. They're sensitive to pressure changes because of this, and this allows them to perform a crucial role in control of blood pressure as well as heart rate. The superficial temporal artery is a terminal branch from the external carotid artery. It's a major artery of the head and supplies blood to the skin and muscles on either side of the face and scalp. The facial artery is a branch of the external carotid artery, and it supplies structures to the face. Okay, and that's shown here. Finally, the occipital artery. This arises from the external carotid artery opposite the facial artery. It's going to supply blood to the back of the scalp as well as the sternocleidomastoid muscles and deep muscles in the back and neck. Okay, so now we're going to continue to follow the flow of oxygenated blood through the upper limb. So the axillary artery shown here, represents the continuation of the subclavian artery, and it is a major artery of the upper limb. Now, the change from subclavian to axillary occurs as it passes under the clavicle on the outer edge near that first rib. Okay, so this is going to convey oxygenated blood to the lateral thorax, the axilla, and the upper limb. So one of the branches coming off of the axillary artery is the thoracoacromial artery. This is a short trunk that arises from that axillary artery. It supplies muscles and the skin of the pectoral region with oxygenated blood. Another branch coming off the axillary artery is one of the larger branches. It supplies blood to several muscles on the lateral and posterior portion of the torso, and this is the subscapular artery. Next is the brachial artery. The brachial artery is the major blood vessel of the upper arm. It is the continuation of the axillary artery beyond this lower margin of the teres major muscle, which isn't shown in this image. So it's going to continue down the ventral surface of the arm until it reaches the elbow. This brachial artery is suitable for several clinical examinations, such as pulse and blood pressure measurements. And it's going to supply blood to the biceps brachii, triceps brachii, and coracobrachialis muscles. The deep brachial artery is a branch of the brachial artery, and it supplies the posterior of the arm muscles and the shaft of the humerus with oxygenated blood. The ulnar collateral arteries branch from the brachial artery, and they form a network of collateral circulation around the elbow joint. And so if you follow them down to the bottom of this image, you can see that they are that they merge or reconnect. And then when they do, they merge into the ulnar artery. This is referred to an anastomosis or anastomoses. So the brachial artery terminates when it branches into the two main arteries of the forearm, the radial artery and the ulnar artery. The radial artery supplies the anterior compartment of the blood of the forearm with oxygenated blood, and the ulnar artery supplies the medial aspects of the forearm. So the anterior the anterior interosseous artery, shown here, it's kind of in the midline, delivers blood from the ulnar artery to the deep layer of that compartment, of the anterior compartment of the forearm. The ulnar and radial arteries ultimately will terminate in the superficial and deep palmar arches, and they are going to supply the digits, for the most part, with oxygenated blood. So before I move on to the arteries of the lower extremities and torso, let's look back at the veins from the head, upper torso, and upper limbs, and how that's going to return deoxygenated blood back to the heart. So let's start with the head. Like the arteries, the veins pictured here are also located on the other side of the head. So the temporal and facial vein drains into that internal jugular, located here, and then you have the occipital vein, which may drain into the external jugular or the internal jugular. There's kind of a crossover just above. Okay, so moving on to the upper limb. So one of the larger veins of the upper limb is the medial antebrachial vein. This is a superficial vein, so the lighter colored veins in this image are superficial, and the darker colored veins are the deep veins. So that's going to be a theme that you'll see in several other images. So the antebrachial vein runs along the forearm and drains the palm and the anterior forearm into the basilic vein. The basilic vein is a large supervein of the upper limb, and it runs down the ulnar side of the arm, and it drains into the axillary, which I'll talk about in a second. The median cubital vein is also a superficial vein of the upper limb. It's very clinically relevant as it is routinely used for venipuncture or taking blood, and it's also a site for introducing IVs. So why is that? This is due to the fact that it has a pretty wide lumen. The lumen is the inside of the vein, and its tendency to remain stationary upon needle insertion. So this vein, it's going to connect the basilic and cephalic vein, and it also becomes really prominent when pressure is applied to it. So the cephalic vein is another superficial vein that I've already mentioned a couple times, and it drains the radial part of the hand, forearm, and arm, and it kind of communicates its course along with the basilic vein. So these kind of run together along either side of the arm. So next I want to talk about the brachial veins. These are deep veins that share the same name as the arteries that they accompany. The brachial and basilic veins are going to join, and that's going to, they're going to merge, and then they will become the axillary vein, which is up here at the top. That's where the label is. And so then the terminal part of the axillary vein is going to join in that cephalic vein, and then ultimately it will continue as the subclavian vein near the first rib. All right, so the blood from the upper torso and limbs have to return to the heart, and this is performed by veins, many of which have companion arteries. So keep in mind that in this image, I've only labeled one of each paired vein. So although I discussed the jugular veins on the previous slide, I left them up here for reference. So the remaining major veins from the upper torso that I want to point out are the subclavian vein, which is a paired vein on either side of the body, and it's responsible for draining blood from the upper limb. So I just discussed how the cephalic and axillary vein merge and drain into the subclavian vein. The brachiocephalic veins are large veins that originate from the union of the subclavian vein with the internal jugular vein. So the left and right brachiocephalic veins are then going to join to form the superior vena cava on the right side of the upper chest. As mentioned in several presentations, the superior vena cava is then going to return blood to the right atria through the superior vena cava opening. So that is it for the vascular anatomy part 1. In part 2, we're going to discuss arteries and veins of the abdomen, the hepatic portal system, arteries and veins of the lower limbs, as well as the pulmonary circuit. Thank you for watching.